Today we're going to go over how to use the ScoliRoll, and there's two different types of ScoliRolls. One of those is called a thoracic ScoliRoll, which is typically used when someone has a primary curve in the thoracic spine, potentially thoracolumbar, and I'll talk about that in a second. And then we have a lumbar ScoliRoll, which is used for someone that has a scoliosis or a primary scoliosis in the lumbar spine. Now, what these are and why we use them with Scoliosis Rehab is they're basically an orthotic device that help assist or aid in the other treatments we use. They can be great adjunctive treatment for Scoli balance, scoliosis-specific rehab, and also when we're using Scoli brace. Now, some people that are not candidates for this, and this is important to know, if you have an acute fracture, that's definitely a contraindication to using one of these orthotic devices. If you have a spinal infection, that's an absolute contraindication to using one of these orthotic devices. And if you have any hemangioma, that's a definite contraindication to using one of these. Now, there's also a few things that are potential contraindication. That's something you really need to discuss with your healthcare practitioner. One of those could be if you have osteoporosis and the provider is worried about a potential fracture if you're putting too much pressure on the spine or rib cage. Another one be if you have increased pain using one of these, and there may be some discomfort in the beginning, but if you're having increased pain using one of these, you need to discuss that with your provider to see if it's something that you should or should not be using. And another contraindication is if you have an instability in your spine, especially if you have a large lateral aesthesis. This is something that you may not want to use, or you may need to modify how long you're possibly using one of these. Now, why we use these is because they help us get more benefits or better results with the other scoliosis treatments that we do. These are basically devices that put your spine into a corrected position, and they do three things. One, they de-rotate the spine because scoliosis is a rotational deformity, so they're going to rotate your spine back in the correct position. Second, they're going to laterally flex or bend your spine. And third, they're going to translate your spine if we're trying to do that. When you get scoliosis, when the spine rotates, your spine starts to get very stiff. And so these help us get a lot of mobility back in the spine, which helps with our results with the Scoli balance, Scoliosis Rehab, and they make it easier for the brace to do its job when it's trying to correct your spine. The other thing they do is they can actually help stretch and lengthen tight muscles, especially when you have a curve, when you have a scoliosis, the inside of the curve or on the concave side of the curve, those muscles are shortened, so we need to stretch those out. They also help with what's called plasticity or creep. When you have white connective tissues like ligaments and discs, when your spine is in a different position, which it is with scoliosis, those ligaments can actually change shape. And when we put the spine in a correct position, it'll actually stretch those ligaments. And when we hold that there for over 10 minutes, we start to get some permanent stretching of those connective tissues. Now, I don't have time to go over every possible setup because everyone's spine is different. And based on their curve, the location, and various other factors, we're going to vary the setup. And so you need to make sure you're going to a skilled practitioner that's very trained in scoliosis rehab and knows how to properly use these devices so they can show you exactly how to set up your spine. Because if you're using these and you're not putting yourself in the right setup, you could potentially be making your spine worse off. So for today, I'm just going to go for two possible scenarios. I'm going to demonstrate using the lumbar ScoliRoll, and I'm actually going to demonstrate using the thoracic ScoliRoll. So to help me with this, I have one of our scoliosis rehab technicians, Emma, who's going to come over here. And in this first scenario, we're going to assume Emma has a lumbar scoliosis and she does not have any secondary curve, just a primary lumbar scoliosis, and her spine is in coronal balance, meaning she's not shifted off to the side. And we're going to say that she has a left lumbar scoliosis. We're going to use the lumbar ScoliRoll. So we're going to use actually a dental roll table, but at home you would do this on some kind of hard surface. This doesn't work really well if you're doing it on the sofa or bed or something like that. So Emma's going to come on over here and she's going to lay down. And she knows exactly how to position this, which makes it a lot easier. So she would lay on our spine and we would teach her how to put this right where the peak curve is. We're going to give her a pillow to support her head to make sure her head stays in a nice neutral position. Then we're going to give her another pillow. Actually, this one's a little better for your head. I'm going to pick that up. There we go. Another one to put between her knees to make sure we're not putting in any excessive stress. And she's laying on there, and it's basically, imagine she has a curve like this. It's actually putting herself in a correct position. Now, if she had a thoracic curve here going in the opposite way. We may need to put some blocks under this side to build that up to make sure we're not making this upper curve worse, because what's going on here is the opposite of what's going on here. Now, once she's been doing this for a while and she can lay on this for 15 to 20 minutes, we can actually start to work on some strengthening exercise and give her some core stabilizing exercise to do while she's laying on this. Now, one thing you can't see when I view her from the side, she is basically perpendicular to the table. So her spine is straight up and down like this. And some simple exercises we could add are some simple leg raises where she can bring her leg up. And now she's working the muscles in here. We can give her a weight in the arm and she can do some lateral arm raises there. And eventually we could even do some where she's bringing her arm and leg together. But basically giving her some simple core exercises to work on strengthening her core while she's holding her spine in a correct position. Now, the next setup, we're going to assume she has a thoracic scoliosis right here. I'm going to remove the lumbar one. I'm going to grab the thoracic ScoliRoll, which is broader and wider, so it works a little better in the rib cage. I would know right where her curve is, so I'm going to put that right by the peak of her curve. I'm still going to hold her head in the same position, and we're going to assume that she has a thoracic scoliosis. She does not have any secondary lumbar scoliosis or any tertiary scoliosis up here. Now, what I may need to do too is put a block under her pelvis to raise this up a little bit to prevent a secondary curve to developing, because I don't want to make a curve in here. I'm going to bring this up a little bit here. I'm going to move this. Okay. Once I have it in the right position here, one thing we're going to do, she's actually going to rotate her body back a little bit. We don't want her exactly perpendicular. She's going to be angled because I want the peak of this to be on the peak of her scoliosis. Because when you have a thoracic curve, the spine is actually rotating, and we're going to put that on the peak of her rib cage. Now, she's actually laying on her left side, but notice most thoracic curves are going to be on the right side. So this is just two different simple setups. We probably have over 20 or plus different variations of this, so you have to make sure you're going to a skilled provider to make sure you're getting the proper setup. So I hope you found that helpful, and to learn more about other scoliosis treatments, click on our next video, and I'll see you there.